Hello, my name is Chinenye Okafor. I'm a second-year internal medicine resident at MUSC, Florence, South Carolina. I'll be attending the AACR conference this year in San Diego. I'll be presenting two poster researches during the conference. So my first poster was we were looking at social determinants and lifestyle factors that drive mortality in colorectal cancer, mostly in younger Black and white patients. And for this, we use data from MUSC Hollings Cancer Registry. And we did have a good proportion of, white and Black patients represented in our data. And what we focused on was to try to figure out what specific factors in terms of demographics, in terms of lifestyle factors like alcohol and smoking, and social determinant factors like social deprivation index that could be driving worse outcomes in Black and white patients, which is something that is already well known. And we did find some significant factors like smoking, alcohol, and this was more evident in younger patients, younger Black compared to white patients. And in older patients that's 65 years and older, there was not a lot of differences. So we do know that social determinants, lifestyle factors is driving mortality, but it's more evident in the younger population. And it'll be interesting to kind of see how socioeconomic factors, insurance status, and all these other things that are not available to younger patients, how those play out to drive these mortality differences when you compare them to older patients that don't have these differences going forward. The second research I worked on that I'll be presenting at AACR is on political ideology and how that relates to cancer fatalistic beliefs. For this, we used the HINT survey, which is an NCI database. And what we basically looked at is responses from respondents, basically asking them specific questions relating to their political ideology and trying to associate that with cancer fatalistic beliefs. We think this is important because we know that persons that have fatalistic beliefs are less likely to, be adherent to screenings, and wanted to see if political ideology could be one of the things that could be associated with that could, drive messaging in terms of, advertising for screenings and, recommendations related to that. And we did find some significant significance with political ideology in terms of fatalistic cancer beliefs, in terms of the conservatives, liberals, and moderates. And some of those information also will be presenting at AACR conference in San Diego. Looking forward to discussing more with anyone who's interested in learning more about this. Thank you.